What are congenital abnormalities of the uterus or birth defects of the uterus? To understand this, first you need to understand how the uterus develops. So when you are a fetus in your mother's womb, that is when the uterus and the other reproductive organs develop. Development actually begins like two small buds of tissue on either side of the abdomen. As your mother's pregnancy progresses with you in your mother's womb, these buds of tissue extend and elongate and slowly come to the midline and fuse in the midline. And this leads to the development of the fallopian tubes, the uterus, the cervix, and even the upper vagina. The development of the lower vagina and the ovaries is an entirely different embryonic origin. So if these buds of tissue completely fail to develop, it is known as uterine agenesis or complete absence of the uterus and the tubes. It may happen that the two buds develop but remain separate completely, and that is uterus didelphys. It may happen that the two buds of tissue develop and come to the midline but fuse incompletely, and that leads to a biconate uterus, which may be complete or which may be partial. It may sometimes happen that the uterine bud develops only on one side and fails to develop on the other side, and this leads to the development of a uniconate uterus. It may have an attached horn, as in an incompletely developed other side, or it may not have the other side at all. Sometimes the fusion happens, but the septum in between fails to resorb or fails to disappear, and this leads to the development of a uterine septum. A uterine septum again can be complete or partial. Now, the congenital abnormality that we are concerned about as fertility specialists, and the congenital abnormality which can interfere with fertility or pregnancy, is the uterine septum. Congenital abnormalities are not difficult to diagnose. We suspect an abnormality even on a transvaginal sonography, which is done as a routine baseline evaluation at your fertility doctor's clinic. If there is a suspicion of any congenital abnormality, we usually advise you to get a 3D sonography done. And today 3D sonography reports make it amply clear which type of congenital abnormality you have. Most abnormalities we don't do anything about, and you may be able to get pregnant on your own, and your pregnancy may even be uneventful. It is the uterine septum that we are worried about. So if a septum is identified on a 3D scan, we will advise you to do a hysteroscopy for a septum resection. One thing to keep in mind for women with congenital abnormalities is that there is a slightly higher risk of having miscarriage or even incompetent OS or preterm labor. When a woman with congenital uterine abnormalities is planning fertility treatment or planning IVF, intentionally we prefer to transfer only one embryo and not two embryos in order to avoid a twin pregnancy. So if you are worried that you have a congenital abnormality of your uterus, or if you have an ultrasound report or an HSG report which is suggestive of an abnormality and you have questions to ask me, do get in touch.